We're helping you, as I say, get your pretty on, okay? We're get your pretty on this morning. And the new thing we're going to show is eMatrix. Dr. Bernstein's here. He's going to tell us how this procedure could make the holidays, well, just more fabulous.
Jam.
Yeah, okay, here's what we're doing, Mike. We're getting our pretty on. And today we're talking about making the face fuller, plumper. We did the stuff with Dr. Bloom earlier, and now we bring in the big dog. Good morning.
Good morning.
Okay, so you're known for all your laser stuff, but if people take a look at us, we don't have on our big eyeglasses today. Why is that?
Well, because we don't need them.
Okay.
You know, technologies are creeping into medicine all over. It's like an explosive growth. Same with aesthetics are looking good. This is radio frequency, so we don't need glasses. Fractionated radio frequency, which means tiny little dots of radio frequency energy, and because it's a different type of energy, the results are different. We use this for pumping, and we use it in conjunction with topical products, and the way we use it, there's really no downtime.
Okay, so Ellen's going to get this baby started, and so again, it's not exactly like a dermabrasioner, and it's not exactly like a laserer, but it does feel warm.
Yeah, you feel like a little, tiny little pinch when you put it against the skin, and it's, you know, it's interesting. We have so many technologies and that are creeping into medicine now. Yeah. Cold therapy, ultrasound, and radio frequency.
So I know that we've talked when we talk about laser stuff and your clear and brilliant things that you guys do. You want to damage the skin and then put the good juice on top of it, like creams and stuff?
Right, but we don't say damage, we say stimulate.
Oh, stimulate.
Because you could damage the skin without doing anything good.
Okay.
So these devices kind of make tiny little holes, put energy in, and stimulate the skin. And you can see the machine regulates to make sure each pulse is perfect. If it's not perfect, it stops. You see a little red line, like, see, dry the skin, it says there a little bit. And we clean the tip. So
what kind of person, like, what is the ideal client patient for something like this?
Well, somebody whose skin, you know, is just starting to show some signs of really sun damage, not aging, because it's the sun that ages our skin. And you want to freshen up and rejuvenate. You want a little bit of plumping. So we often use this in combination with other things like fillers and Botox and topicals. You got to be all you can be. And in aesthetics, 2 + 2 + 2 = 15.
Okay.
You know, if you combine things, you tend to do better. So this is just another device, and you know, we're lucky here. We have over 30 devices, so I could pick and choose, and that's why I was so excited to be here on Monday. My job's really fun.
The only man in America that likes to come to work on a Monday.
It's fun.
It's weird. Quite frankly, I can't explain it. All right, so we see that she's getting a little bit pink.
Exactly.
How long will that last, the pinkness?
You know, everybody's different. It lasts from a few hours to up to a day, day and a half. You look a little bit pink, and that hive reaction, that's what stimulates new collagen, regeneration of the skin. You can't really get that without a tiny bit of inflammation. But inflammation's not irritation. It's a good thing. All these complicated words. The bottom line is you get pink, you rejuvenate your skin, and then we put a topical one right after this that gets deep down.
I was going to say, I was talking to Ellen because, you know, you got to talk to the RNs. The doctors know one thing, but the nurses, they know the good stuff. And she said if you're really good about using your lotions, your creams, your serums, when you do something like this, then it can, like, this is the medical term, super duper suck it in.
Yep, it does. Because what happens is the skin cells that are meant to block out stuff from getting in, they separate a little bit. And so topical products can get right in between.
That's the best you've ever explained anything to us. Well, you should use that again.
That's because it's Monday morning. It's on one of my videos my patients see.
Okay, let me ask you a question.
Sure.
Anyone who shouldn't do this, who's not a candidate?
This one, not really anybody, you know. You can use it on all skin types. You know, it's not a matter of who can't use this. It's a matter of which device is optimal for which person.
Okay.
Some people like me have too much redness. Some have wrinkling. And it really depends on what we're treating.
Okay.
But this one, for anybody who needs it, basically.
All right. And I haven't seen a single flinch out of her, which is good news. So, Mike, I know that you love to look so spiffy for your family.
Yes, I need that. What's it feel like?
You know, we're in Suburban Square, so I could come visit you and hold your hand should you get this done.
Thank you. Do you know what it feels like? I mean, what is she experiencing? She hasn't moved at all. I'm not even sure she's alive.
Here's the thing. Typically, you can see it in their hands and stuff. I can't see anything. Give us a thumbs up. She likes it. You can usually tell. this woman, either she feels no pain or she's ready for an Oscar because she's really acting. She might be a Navy SEAL. Yes.
Ellen's a Navy SEAL.
They say that it kind of feels like a rubber band being snapped onto your skin.
Oh, I could handle that.
Yeah, it's not that bad. Okay.